Hello everyone, thank you so much for joining me on yet another edifying edition of your health program, You're in Health, and on Equinoxe Radio Multimedia. Tonight we'll be talking about gum disease. Gum disease, also known as periodontal disease, is a prevalent oral health issue affecting millions worldwide, impacting not just mouths but overall health. How common is gum disease in Cameroon, and what are the effects of oral it can have on our oral health? That's what we're going to be looking at with our medical expert. But before introducing him, let's welcome my co-host, Ace Lucy Lengo. Good day, Lucy. It's a pleasure to have you on the program.
Thank you so much, Immaculate Fogwe, and good day to all our listeners and viewers out there.
Now we'll be unveiling who our guest is. Lucy, we have a special guest. He's known as Dr. Kelmed NFOR. He is a dental surgeon based in Gabon. Good day. It's a pleasure to have you on the program.
Good day, Immaculate Fogwe. Good day, Lucy. Good afternoon to you, and good afternoon to televiewers and our listeners. It's an honor for me to be on your platform today to talk about health, most especially oral health. Thank you for the invitation.
Always a pleasure.
Always a pleasure, Lucy. So as I earlier said, we are going to be talking about gum disease in simplest terms, in such a way that even our mothers in the house can understand. What's it all about? Can you define it?
Thank you very much for the question. Gum disease is a broad term which describes any inflammation, any soreness, or any infection on the structure supporting the tooth. When we talk about the structure supporting the tooth, we have the gum itself, we have beneath the gum the alveolar bone, we have the ligament that holds the teeth together, which we call the periodontal ligament, and we have another layer known as the cementum. So when there is any infection, any inflammation on all these structures which I made mention of, there we talk about gum disease or periodontal disease in general, like you earlier mentioned. So when there is an infection just on the gum, there we talk about gingivitis, inflammation on the gum. Now, when it goes beyond the gum and gets the layer beneath, there we start talking about periodontal diseases. So we can make the difference between gingivitis and periodontitis. Periodontitis is the layer beneath, which is sometimes irreversible for periodontitis. Meanwhile, gingivitis is reversible.
Now, you talked about the inflammation as one of the symptoms. Apart from inflammation of the gum, are there other symptoms to know that this is a gum disease?
Yes, when someone suffers from gum disease, it's very easy for you to determine that. First, we have the inflammation. Secondly, we have bleeding gum. You would see that the gum bleeds even with contact with food or with, for instance, we have patients or people when they bite, let's say a loaf of bread, you would see on the leftover, you will see blood there. That's a sign. Also, we could have it becomes very tender or very painful on touch. Also, and when this gum becomes inflamed, like I mentioned, there is what we call gum recession. The gum leaves the tooth, and with this gum recession, there is sensitivity because the gum protects or surrounds the tooth. So when there is this recession, there we start having sensitivity, which is one of the signs. And we could also make mention of what. Maybe it's going to come again.
Okay.
Painful pain, which is one of the
symptoms.
The symptoms. Pain during chewing, pain during even spontaneously, the spontaneous pain that comes out. So these are some of the signs and symptoms of gum disease.
Okay. All right, doctor, before we come back to you, who give out the numbers for those who like to participate in today's edition, we have 670-5470-49, 670-5470-49, or 656-62-2222, 656-62-2222 at the end. And back to you, doctor. In your practice, how do we diagnose gum disease?
The diagnosis for gum disease is first clinical, and clinically observation. So when a patient comes, you take, after taking the medical history, now you will observe what you want to see is the signs and symptoms we said. Yeah. Is it inflamed? Is it bleeding on probing? We have what we call a probe. We will try to find out some point. Is it bleeding? If it's bleeding, yes, then we are faced with probably a gum disease, and we can go forward to do even an X-ray to see if there's a presence of pockets, or called periodontal pockets. They are just the spaces in between the teeth where food debris gets stuck, and we get stuck on the X-ray. You can really identify these pockets. So with this already, we can be drawing. We can give an orientation via or towards gum disease.
Gum disease. And now we also want to understand some of the causes. You have made mention of the symptoms. What are some of those key factors that can lead to a gum disease?
The causes for gum disease are multifactorial. We have many, but to ease our comprehension, I'm going to group them into two. What we call plague-induced gum disease and the non-plague-induced gum disease. We'll start from the plague, and to define what plague is, it's just simply about biofilm or a layer. When we talk about biofilm, that is slimming saliva that is mixed up with bacteria, food debris. So when this biofilm gets accumulated on the teeth, the bacteria will consume the food debris and release its toxin and some virulent factor on the gum. When these virulent factors are sent to the gum, it causes the inflammation. When there is this inflammation, there is redness, or the gum becomes erythematous in nature. And from there, you would see the color of the gum, which is normally pink. That's normal color. Now it becomes reddish in nature. That's the main cause. Now we could go further to have the non-plague induced, for instance, as a result of systemic factors, some systemic diseases that can cause gum disease. We could have even some hormonal changes. For instance, puberty. There is puberty associated with there is gum disease associated with puberty. There is even pregnancy. So we have women at the point of pregnancy, the gums becomes very inflamed, and you could even have proliferations along the gum, what we call medically pyogenic granuloma on these gums. We could also have this gum disease as a result of menstrual cycle associated gingivitis. So another, even some blood diseases, even with immunosuppressed patients, or those suffering from HIV and AIDS. So the sequelae of the disease are manifested in the gums.
What about tobacco? What about sweet things that we consume, sugary things? Can it also lead to gum disease?
Yes, these are predisposing factors. When you smoke tobacco, or you in all its form, be it shisha, be it whatever. So in the long run, you would have the consequences being displayed on the gum.
On the gum.
What treatment options do you recommend for people early stage of gum disease?
The treatment option, the treatment option first is what you do at home. Because what you do at home every day, that's part of the treatment. So your brushing technique really matters. Brushing, that is getting rid of the food debris or the plague I made mention of daily, that is morning and evening, so that you don't give the chance for the bacteria to act on the food debris, thereby sending its toxin that would irritate the gum. So you brush morning and evening with fluoride toothpaste, and would also prescribe or would also advise the use of an antiseptic mouthwash to get rid of some of these bacteria which are harmful to the mouth. So when you do that, if there is already the disease at the mild stage, it can be reversed. I earlier mentioned gingivitis can be reversed at the early stage.
Exactly.
Then when it gets to the latter stage, where the plague has been accumulated and has been calcified to form what we call tartar, you would see a yellowish substance are always around the teeth. We call that tartar or calculus. There, at that level, the toothbrush can't get it off. So you need a medical attention. Now, in the dental office, we will do what we call scaling and polishing of the teeth, which is removing all this started build up.
Okay.
And after doing that, we can do what we call root planning, making the place smooth. Then we would prescribe an appropriate mouthwash, and if necessary, we will prescribe an antibiotic, which would help.
How different is toothpaste from an antiseptic mouthwash?
Yes, there is a difference between toothpaste and antiseptic mouthwash. First of all, we have two types of toothpaste.
Okay.
And also generally, we have the commercial toothpaste, which we can get from the nearby stores,
Yeah.
with a calculated amount of fluoride, which
Yeah.
is the main component. It's about 1,000 to 1,500 ppm. Now, we have the therapeutic toothpaste. So for that, we prescribe in the hospital
Okay.
for a particular purpose. So the toothpaste could be gel-like in nature, and is very it's a local treatment. So
Okay.
it's for a particular purpose. Now, you talked about the mouthwash.
Exactly.
It's just a liquid. It's just a liquid substance that you do.
Gargle.
You gargle your mouth with. It is an antiseptic. It's antiseptic in nature, and it helps to do away with any.
So the
any
toothpaste
bacteria.
isn't antiseptic?
Not really, but some toothpaste we have some antiseptic property
Okay.
that are added to it.
Okay.
Then what about some of these products that we have that sell in buses when we are traveling? We have the liquid product,
Shiny.
shiny. Can it also help to remove some of these substances that you mentioned?
Some of these substances are very abrasive. Sometimes we don't really know the constituent of this substance. When we look at them, so you would use them quite all right. It's going to, when you talk about shiny, you want the teeth to be clean
Yeah.
or to look. Also, it has a high abrasive property that it can remove any stain, which is good. But the consequences after removing the stain is that in the long run, when it removes the outer layer, which is the enamel of the teeth, so the layer beneath, which is the dentine, is exposed, and the dentine is highly innervated. So the first consequence is generalized teeth sensitivity. You realize that you can't drink cold water, you can't even get in air. So that general discomfort from teeth. So those products, for me, I would advise, if you don't know really what you're taking, it's good you avoid them.
Now, talking about the type of toothbrush we use, we have some people that every time they try to brush their teeth, they notice that blood is oozing out from their gums at every time they try to brush. Does that signal some sort of... We have a call on the line. We'll come back to that question.
Okay.
Hello.
Yeah, hello.
Good afternoon, sir. Your name and where you're calling us from?
Yeah, I'm calling from Yaoundé.
Okay, your question.
Yes, I really wanted to know, from the doctor, whether the anti-inflammatory treatment, like they talk about painkiller, can also get rid with the pains.
Okay.
I didn't understand his
Me too, I
question.
didn't understand the
Hello?
question. Hello, sir?
If you can come back again.
I
Okay.
didn't understand the question.
He's asking whether he's asking something like some painkillers. Can they help to relieve pain when it concerns
gum
the
disease?
gum?
Okay.
Yeah.
Oh, if that's the question, yeah. Painkiller, like the name goes, it will reduce the pain for a while. But remember, if you don't treat the underlying cause of the pain, it will still come back.
Okay.
And the prolonged use of this painkiller also has its own effect on the organs, on the kidney, on the liver, and all that.
I see.
So-
So before that call, we're talking about the type of toothbrush we use. We have people who, when brushing their teeth, they notice that there's blood oozing from their gums at some period. Should that be... Should we... we have another call on the line.
Hello? Hello?
Please turn off your receiver, please.
Okay.
Yeah, when you turn on your receiver, you ask your question, sir. Okay.
We lost that caller. Please, when you're trying to call, turn off your radio, turn off your TV sets, because when you leave it on, the communication is not clear. You have to take note of this, please, whenever you're trying to take part in today's program. Back to you, Doctor. We're talking about the toothbrush. How can toothbrush affect our gums?
That's a very important question. We need to be very mindful of the type of toothbrush we use. So we always advise our patients to use toothbrush which is medium, not too hard, because when you use a toothbrush that is too hard, it irritates the gum. That's why when you brush, and you would see blood oozing out. So the toothbrush should be medium. Also, the bristles, it should be very soft. It should be very soft to medium. Also.
But Lucy, have you never heard people saying that they prefer the hard one because they want to have the teeth really look clean
and shiny?
That's the thing that is soft. The bristle that you're talking about is so soft, it will not really have that effect. On the teeth. Are they right or are they wrong?
When it's too hard, also there is also the effect. You'd see. So the gum really that is supposed to be the neck of the teeth finds itself going apically. Also, and exposing the roots, so teeth sensitivity. So the medium is good. And if you're because the initial reason why they want to use the hard is so that the teeth should be shiny.
Exactly.
So you come to the clinic. So we have machines. If there are stains, we have the machine where we would do the scaling. And we'll do the polishing of your teeth. That will give that nature. But if you use a hard toothbrush for a long time, you would have that effect.
All right. Immaculate, you mentioned toothbrush, but we're also addressing those in the suburbs, like in the village. We have some people too, when their toothpaste gets finished in the house, they start using, let me say, soap. We have savon. They start using even charcoal, salt. Is it advisable for our teeth?
It's not advisable to use soap because the process of fabrication of soap, I think saponification, or they use a lot of chemicals in it, which is not advisable for the teeth.
It seems as if we have another call on the line.
Hello.
Yes, sir. Your name and where you're calling us from?
I'm called Fabrice Nonne from Limbe.
Okay. Welcome to the program. Your question.
Yeah, I just want to ask the doctor. I have a strong brush, I need medication with a strong brush. What have to do again for use them? Because anytime there's a strong brush, I get wound for my teeth.
Exactly what we are talking about. Yeah.
For your teeth. Or you get wound for side. When you use a strong brush, you get wound for side.
My gums.
Your gums. Okay, doctor, don't hear your question or the answer now. Doc, you got the question.
Okay.
Thank you very much, sir, for your question. Really, like I think we made mention of that. The hard toothbrush, which is not good because it causes that's the immediate consequence. You see the gum wounding the gums, the gum bleeding over and over. So it's not good. So what I would advise you, sir, is for you to visit a dental clinic. Now, the dentist would observe if there are any damages done, and from there they can do a repair, and advice on a toothbrush which you're supposed to use adequately.
Any last advice you have for those watching at the moment?
Well, gum disease is becoming more and more current in the society. So if I want to advise, or if you have bleeding gums, if you have painful gums or your teeth, visit your dentist, and from there your dentist would diagnose any eventual problem, then give you a treatment plan that would help. Remember that health is wealth, so when you preserve your health, that's wealth you're preserving.
For sure. Thank you so much, Dr. Kelmed NFOR, for being part of the program.
Thank you very much, Immaculate.
Big thanks to you, Lucy, for being part of the program too.
All right, always a pleasure, Immaculate.
And we will clearly want to thank all of you. Stick to your radio and TV sets on today's edition of the program. We say from us to our studios right here to you over there, have a wonderful day. We quality thank our technicians who were back there to make sure that everything works out well. We had Louis Pego, we had Jonathan Biabula, and we equally have our technical crew, who is a beautiful lady there, even though I don't know her name, but we say thank you to you. And we say bye-bye from us to you over there. Bye-bye for now.